It is Thyroid Awareness Month, and the Australian Thyroid Foundation that supports people or Australian citizens with thyroid disorders and also educates the population wants the Australian population to be more aware of the problems of thyroid diseases and the need for individuals who may have a thyroid problem to actually go and get tested. Now, it's a disorder that's often overlooked, not discussed very much, but it is one of the commonest disorders that we have in Australia. The two major causes are autoimmunity, where the cells in the body actually attack that individual, and these disorders can cause an underactive thyroid or an overactive thyroid. The other cause is iodine deficiency, that's dietary iodine deficiency, that can result in a swelling of the thyroid gland, and if it occurs during pregnancy, which it does, then it may result in the child being born with a lower IQ. Now we know that there are several million people suffering with thyroid diseases in Australia, and we also know that from our estimations that there are around 1 million people who have a thyroid disorder but have not yet been diagnosed. Now, if you don't think of it and if you don't get tested, then you won't get a diagnosis and you won't get treatment. So if you think that you may have a thyroid disease, then discuss it with your doctor, ask to be tested, ensure that the tests are appropriate, and ensure that the tests are normal to reassure you that you don't need treatment. Now, thyroid disorders can affect you at any stage of life. They're particularly relevant for children because it interferes with growth and development. Thyroid disease in pregnancy is particularly important. It must be tested for early during the pregnancy, in the first couple of months of pregnancy, to ensure that treatment is given to prevent the loss of the pregnancy, or if the pregnancy does proceed, to ensure that the child doesn't suffer some mental effect or intellectual disability. Now, all pregnant women should be tested very early in pregnancy. If there is a family history of thyroid disease, or you, the woman who wants to get pregnant, thinks she may have a thyroid disorder, then she should be tested before pregnancy, and she should ensure that the doctor also tests for thyroid autoantibodies, because the problem is most commonly due to an autoimmune disorder. The other important issue with pregnancy is ensuring that the woman gets enough iodine. If she doesn't get enough iodine in her diet, then that may cause problems for the brain development of the fetus. And the only way to ensure that she get enough iodine is to take an iodine supplement. So it is important that you discuss this with your doctor and you get tested very early during the pregnancy to ensure everything is okay. Thyroid disorders can affect you at any stage of life, and the other important time is for the older population, because a lot of the symptoms of thyroid disorders, particularly an underactive thyroid, are very vague. There may be effects on memory, there may be effects on your ability to think and do your normal work, tiredness, weight gain, skin changes. A lot of these are just put down to the fact of ageing, when what you are seeing is an underactive thyroid. So if you are concerned about changes in your body or symptoms where you're feeling different, then speak to your doctor and ask to have a thyroid test. That is terribly important, because oftentimes this is not picked up until the disease progresses quite severely, and it's very difficult then to reverse. So overall, to summarise, thyroid disorders in Australia are very common. There are over 1 million people, we estimate, have a thyroid problem that haven't been diagnosed, they haven't been tested, and they need to be. So during Thyroid Awareness Month, we need to bring that to everybody's attention, that if you think there is a problem, or in the case of pregnant women, you need to be tested. So talk to your doctor and get the appropriate tests.